Hi, my name is Kiana Steinmetz, and for my return demonstration, I'll be doing scenario 1. My patient is Francis Mashad, and he was admitted to the USM hospital with shortness of breath. He is NPO and has an NG tube in place on low intermittent suction. Over the past 4 hours, Mr. Mashad's NG tube has been putting out 600 milliliters of dark bilious fluid. His serum potassium is 3.2 milliequivalents a liter, and he has a peripheral IV line in place. I have 2 orders. The first, 1,000 milliliters of D5 0.45% normal saline IV, 90 milliliters an hour continuous, followed by 1,000 milliliters D5 and a 0.45 normal saline with 20 milliequivalents potassium chloride IV for NG replacement 1 milliliter to 1 milliliter every 4 hours. Both of my IVF bags have been aseptically primed, and the pump has not yet been set. So I'm gonna answer the 3 administration questions, determining if the patient has been receiving the correct IV fluids, if he's been receiving adequate daily amounts of IV maintenance fluids, and if he is receiving the adequate amount of daily potassium. Okay, so these are my fluids I had to do some math for. So for the 1,000 milliliters of D5 and 0.45 normal saline, IV 90 milliliters an hour continuous. So we're going to take 90 milliliters and times it by 24, and we got 2.2 liters, which is good maintenance for his normal saline. So then 2.2 liters times 77 milliequivalents a liter is 169.4 sodium, which is also at his maintenance requirements. And then there is no potassium in his normal saline, which is a problem, especially since he has low potassium serum. So then for the second order, that's 1,000 milliliters of D5, 0.45% normal saline with 20 milliequivalents IV for NG replacement, 1 milliliter to 1 milliliter every 4 hours. I also had to do some math, so I divided 600, which is what he was losing, by 4 because it was every 4 hours, and I got 150 milliliters an hour is what he's losing. And since he is getting 20 milliequivalents of potassium here, we're replacing what he's losing, but he still isn't getting enough maintenance potassium. And then I went into the 3 questions, which was the hypertonic solution, which is good, means that we're increasing intravascular volume, and we're going to check for phlebitis, and we're also going to keep checking his vital signs since it is hypertonic, and you need to be careful administering that. Maintenance fluids, like I said before, were good at 2.2 liters, and then his daily potassium is not being maintained, especially since he's a low serum and he's NPO. Alright, so now I'm going to be going into my MAR and checking my order against the MAR to make sure it's the right patient, right route, right dose, right time, right documentation, and right med. So first we're going to check Francis Mashad and check that his birthday checks against the order I was given. And then he has no known allergies, which is important before I give any medication. And then we're going to go down into his orders, which is what I'll be giving is the 20 milliequivalents potassium chloride in 5% dextrose and 0.45 sodium chloride. And we see that the dose is the same every 4 hours, and the route is IV. And there's no end date yet, so we're going to continue doing 1 milliliter to 1 milliliter every 4 hours for his NG replacement. And then the 5% dextrose and 0.45 sodium chloride, which is his continuous order, and the rate is 90 milliliters an hour. Route is IV, and again, this is still a continuing order and there's no end date. So I'm going to walk into my patient, Mr. Mashad's room, pump in, and gloves, of course. Okay, hi, Mr. Mashad, how are you?
Good.
My name's Kiana. I'll be your nurse today. Can you tell me your name and date of birth?
Yes, I can. It's going to be 4/10/1939.
Okay, perfect. I'm just going to check that against my MAR over here, which is what I have, and happy birthday. So today I'm going to be giving you some maintenance and replacement fluids since you do have an NG tube and you're putting out 600 milliliters of bilious fluid. We're going to replace that and keep you hydrated. So I'm going to start by checking your IV site, and we're going to make sure that there's no signs of phlebitis. Do you have any pain or anything? Okay, and there's no redness, it's not warm to touch, and the area is dry and intact. So I'm going to start by cleaning I'm going to remove the hub, and I'm going to clean this site for 15 seconds. And of course, like I said, I have gloves on. Okay, so now I'm going to flush the site. We're going to put this in, and then I'm going to pull back and make sure I get some blood return, and then I'm going to flush the site. And do you have any pain with that?
I do not.
Okay, great. So now I'm going to clean the hub again for 15 more seconds. Okay, and then after that, now I'm going to take my line, and we're going to this is sterile, so we need to make sure that it doesn't touch anything else besides the site. It came out of the package sterile, so we're going to insert this then. Okay, without touching anything else. Okay, perfect. And now I'm going to go set my pump. So now that we're at my pump, and I'm going to set it each one separately. So my A line is going to be the 1,000 milliliters of D5 0.45 normal saline, and we're gonna set the rate at 90 milliliters an hour, and the volume to be infused is gonna be 950 milliliters. And because even though it does say there's 1,000 milliliters in the bag, I would set it to 950 because it's a continuous line, and I want it to alert me a little bit before the pump is up, so I can get a new rubber bag and make sure I replace it on time. Whereas my B is going to be the 1,000 milliliters of D5 0.45 normal saline with 20 milliequivalents of potassium chloride IV for NG replacement 1 milliliter to 1 milliliter every 4 hours. So this one I would set my rate at 150 milliliters an hour, and this is because when we did the math, we realized that since he was putting out 600 milliliters every 4 hours, that means he's losing 150 milliliters each hour. So we want to replace what is being lost, and that's what the 1 milliliter to 1 milliliter means. And then the volume to be infused is 1,000 milliliters, and we would do this again in 4 hours. All right, and now that the pump is running, do you have any pain or any discomfort, anything like that?
I do not. Okay,
great. And the site still looks good, so if you do start having any pain or irritation, let me know, because that can be a sign that hypertonic solution can cause sometimes. So I'm going to keep an eye on that. I'm going to keep doing my patient's vital signs, probably every 4 hours or so. And then I'm going to lower my patient's call bell. I'm going to lower my patient's bed. I'm going to give him his call bell. I'm going to pump out. And all right, if I can get you anything else, let me know.
Okay, thank you.
So now that I'm back into my MAR, I wanted to pull up my 2 fluids I just gave, and I'm going to make sure, I'm going to document. There is nowhere for me to do it right now, so I'm just going to say that I did the correct patient. So we're going to go back up, and I did check him. Okay, good. Francis Mashad. Back to my 2 orders, and it was the right route, both IV. I did the correct dose, which were each 1,000 milliliters, the correct time, the right medication, and I'm documenting currently.